From the Benson Tower Studio, this is Fox 8 Morning Edition at 7 a.m.
Mayor Mitch Landrieu just named April as Rosacea Awareness Month in New Orleans, and many are helping raise awareness about this. And here with more on that is Dr. Mary Lupo, a dermatologist at Tulane's Medical School. You and I were just, always a pleasure to have you on, by the way.
Thanks, Jerry. Nice to see you.
But you and I were discussing this prior to going on the air. First of all, what is it? What are the symptoms of it?
Well, rosacea is a very common inflammatory skin condition affecting 16 million Americans. It is the cause is unknown, but it is flared by certain things that I think people in New Orleans need to be aware of. In New Orleans, we have a tendency to eat very spicy foods, tend to drink a lot of alcohol, and we have extreme problems, especially in the summer months, with heat and humidity. This is festival time in New Orleans, so it is not uncommon for this time of year for us to see a flare in patients who suffer from rosacea.
So the combination, lifestyle, basically lifestyle can affect it. Are some people more prone to it than others, doctor, because of that?
We tend to see it more in people who are fairer. We do know that sunlight is an exacerbating factor. So because fairer people are more prone to sun damage. In addition, it's primarily a vascular problem with the skin, and the blood vessels abnormally dilate, increasing inflammation to the skin. And there are so many people out there who have the condition and are not aware, and we as doctors, dermatologists, have so many tools that can help them now to improve this situation. Because when you have this flushing and this constant redness of your face, it's very embarrassing.
So is it more than that, though, what it looks like?
You
more
can
than
also
the redness? And there's severe cases, I would think, correct?
Absolutely. You can get papules, pustules. In fact, this used to be called adult acne because it has a pustular component in many people. But this is different from acne. We see it in older age groups. And in severe cases and in long-standing untreated cases, there can be significant damage to the skin, the most extreme being when the nose actually enlarges with a condition called rhinophyma.
And you had mentioned the W.C. Fields from the back in the old days of movies. He had a sampling of that, right?
That would be a classic exaggerated response, but it is possible if you have rosacea untreated for an extended period of time.
Is it a blood test or is it the skin test? Something that's in the blood that does it? How's it diagnosed?
It is diagnosed by a dermatologist because we understand the physical manifestations of it. So it is a diagnosis based on the history and the presentation of the patient when they come into our offices. And dermatologists are expert in identifying the causes, the triggers, and identifying the symptoms to trigger it and calling it rosacea.
You were just showing some slides up on the screen of what it actually does look like. Okay, the patient comes in, he's diagnosed, he or she has it. How do you treat it?
Well, we have a number of prescription drugs that are available now, and we usually make recommendations also to help patients steer away from products or activities that exacerbate it. For example, peppermint is in a lot of products, and peppermint is a known product to exacerbate rosacea. But we have both oral medications and topical prescription medications that your dermatologist can prescribe. You can go, if you're curious, you can go to rosaceafacts.com. There's actually a little quiz that you can take that can help you realize maybe you have this condition, but the ultimate authority in making the diagnosis should be your board-certified dermatologist.
You're making me nervous. Let me look. Can I get a close-up, please?
You're okay.
Doc, it's always a pleasure.
My pleasure,
always
too.
Informative. Thank you so very much. Look forward to our next visit.